raise hand function at the bottom of the screen, and if the chairman allows, we'll bring you in.
Thank you, Dawn. Welcome to our Wednesday afternoon workshop. And Nikki, are you going to lead the way here? Or?
Yeah, I'm just going to make a very quick introduction, if that's okay. Hi, everyone. Good to see you all virtually. We are here today. I brought my colleague Fitzroy Lewis to join you in your workshop today. We wanted to give you guys an update on our community violence prevention grant and efforts. You may or may not know that last year, the Community Health Council received a $300,000 grant from the Pennsylvania Commission on Crime and Delinquency. And this was a grant that we wrote with the help of SARCC and DVI and Empower the Mind, who's a trauma or a therapist here in the county, and also, of course, the Community Health Council. And under the Community Health Council, we do have an initiative that focuses on trauma in our community. And that effort is called Connected Together. So, really we applied for the grant as the Community Health Coalition, but the Connected Together group is really leading this initiative. So we have been active, meaning our our grant approval and funding finally came through in about September. And we were able to bring on a grant coordinator at that time that's covered as part of the grant. And Fitzroy is our grant coordinator, and we're thrilled to have him on board. Fitzroy has a long history here in Lebanon County. And so he's gonna really lead the discussion around the grant. But I just wanted to, I'm very grateful for your time and being able to give you guys an update about this. As you know, issues around community violence continue to sort of plague us. We had a lot of activity last summer around the Black Lives Matter movement, and certainly some issues around race and equality. And then we have had a number of recent and disturbing child abuse cases in our community. And so we really feel like the timing of this grant is very, very good. And we really think that the work that we're doing around trauma and trauma prevention could be very useful to the county as a whole. So I'm not going to take up any more time. I know we just have a couple of minutes here with you guys. I want to introduce Fitzroy and remind him that we only have a couple of minutes.
You're okay as long as the commissioners are okay.
Okay, yeah, great. All right.
Don't feel that kind of pressure, Nikki. And Mr. Lewis, please give us, a little background and also, your presentation, and don't feel rushed.
All right. Well, be careful what you wish for. Be careful.
Well, Ali said it might be 15 minutes, but that was self-imposed. That wasn't anybody telling me.
Oh, okay. All right. Well, between Fitzroy and I, we can both be kind of long-winded. So, but we do want to be able to answer questions as you guys have them. So, Fitzroy.
All right, good afternoon, everyone. Once again, thank you very much for giving us the opportunity to share your space and your time to talk a little bit about the work that we are doing. I have a PowerPoint presentation. However, to respect your time, as Nikki said, I know I can be a bit long-winded, so I won't present that at this time. If you care to, you may give us another opportunity and I can give you more details. However, what I would like to say is that the grant that Nikki talked about has a three-pronged approach to our work in Lebanon County. It's based on the impact of trauma. And trauma is deep-seated, deep-rooted. And one of the first ways that we have implemented addressing the impact of trauma and how that can lead to violence, different forms of violence in our communities, is to make available free of charge mobile trauma therapy. That's one of the provisions of the grant. And so Empower the Mind is the primary resource to be able to provide that therapy. We did that because we recognize for many individuals, the ability to travel restricts their ability to get the services they may need. So we are bringing to them the therapist. So that is one aspect of the work. The other one is to create greater capacity for individuals to receive mental health services, therapy that they can benefit from. We know that many of the service providers in Lebanon County have a backlog of cases. And so by giving the opportunity for practitioners to be trained in EMDR, which is a particular modality of service, has been proven to be effective. It decreases the length of time individuals would spend in therapy because it works in conjunction with other modalities of service. We are hoping that with more individuals trained in this particular modality, it would create greater capacity for individuals to receive the service that they need to be better functioning individuals. So those are the first two aspects. One is immediate, the other one is intermediate. The third and the long term.
Excuse me, before you go on, we have a reporter asking, what does EMDR stand for?
Yes. So EMDR is eye movement desensitization and the reapproachment. I'd have to look that up. Do you have that in front of you, Nikki?
Yeah, reprocessing. So it's
reprocessing.
Eye movement, desensitization, and reprocessing therapy. So if you want, I'm just gonna very quickly bring up the slide that does kind of go through this so that you guys can see there you go. Because it is quite a mouthful.
And I am not a therapist by training, so I am not as familiar with that as therapists would be. But in fact, this was selected because not only is it evidence-based, it's been proven to be very effective, but many individuals who are service providers in the community had requested having greater access to this. And it is an expensive training. However, the grant does allow us to make provisions for at least 10 individuals, maybe up to 14, to be able to access this. And it is a long-term commitment. It's very in-depth, but it is certainly something that we believe would be very beneficial to the long-term well-being of our communities in Lebanon. So that particular service is the intermediate service. The long-term service that we are looking to implement is called Communities That Care. So Communities That Care is not a program. It's actually a process. It's an infrastructure, if you will. It's a framework that is embedded within the community that allows the community to be able to do several things. One is identify what are the risks that exist within the community, what are the issues that present negative impact, negative influences, detrimental influences, but also it helps to identify what are the resources, what are the positive, the protective factors that exist, and finding what activities are already taking place. So we are not looking to duplicate. It's not intended to duplicate anything that is already working. So it would analyze what problems exist, what resources exist, but also, are there any gaps? Are the services that are being provided, are they effective? So that evaluation is one aspect of what Communities That Care does. It also helps the community. These are the individuals who are going to be participating in the work group as members of the Communities That Care Coalition. It would also help them to develop a profile. That is the process of doing the risk analysis, protective factors analysis, and then the gap analysis, and formulate a profile of each community where Communities That Care is going to be engaged. Once that profile is formed, then the community would have to decide, well, what are the issues we want to address? So one community may prioritize something like truancy. Maybe it's underage drinking. Maybe it's teen delinquency. So depending on what the community identifies as its foremost concerns, then the communities that care model is we will help you to identify evidence-based, tested, proven effective programs that would then address that issue. Some of you may be familiar with a program called DARE, D-A-R-E. That's an acronym for a program that was instituted many years ago in various communities in the United States. And when it was first introduced, the idea behind it was if we educate young people about the drugs that are prevalent in their communities and the detrimental impact of those drugs, well, then it seems quite sensible and logical that they would not be inclined to use those substances. Well, what was actually found as a result after studies were done is that being exposed to that particular program actually led to an increase in the use of illicit substances. So sometimes programs are implemented with good intention. However, the science does not support that it will be effective. So we want not only to implement programs, we want to implement programs that are proven to be effective. And so Communities That Care is able to access through a database of various proven effective programs that these are effective for one particular issue or the other, introduce them into the community, help the community to implement those programs, but also to evaluate those programs. How effectively are they working? You know, one size doesn't fit all. A community may be, because of its particular makeup, more responsive to one program as compared to another. And so this is really community-based. The community members are encouraged to engage in the work because the community members themselves, they have a vested interest. They live there. Their friends and neighbors live there. They have a deep concern for the well-being of their community. So therefore, when they become engaged with the other service providers who are already working on those issues, then these programs have a greater opportunity for success. Our ask of the commissioners is not to provide funding. It's not to strong arm anyone. What we are asking, because again, Communities That Care is a program that has been existing in the United States, developed in the University of Washington School of Social Work. It's been used in the United States for about 40 years. In the state of Pennsylvania, it's been used since 1994. There are communities that are still using it 20 years later, because it's, like I said, infrastructure that allows a community to address one problem. If they get to that problem resolved to a satisfactory degree, they can then use that same model to address another issue. So it was purchased in 2005 by the Substance Abuse and Mental Health Support Services, so the Service Administration, the federal government, because it has been tested and proven effective. And so once this process is implemented in the community, it can serve as infrastructure to continually be at work addressing issues that affect the well-being of the community. And so as the commissioners of the county, you have a gargantuan megaphone. Your voice influences what happens within the county. And if you can appreciate the value of this program and lend support to it, then the individuals who listen to you, who take their lead from you, who value your position, your authority, and your concern for the county as a whole, will be more inclined to maybe take a closer look and consideration and then become involved with the implementation and the work of communities that care. So that's what we are looking for. It's for your voice of support.
Fitzroy, I'm just gonna real quickly, I wanna make sure we address Joellen's question, because I think it's a good one. So the Community Health Council has been working in the communities that care model for many, many, many years. And one of the reasons why we've had trouble with the model in the past was that we have tried to apply the communities that care model at the county level. And as we know, the county has all these different pockets of communities and special needs and individualized qualities about it that make it difficult to apply a broad-based solution. So this particular grant is based on 4 pilot communities, and I think Fitzroy mentioned those pilot communities. And the idea is that we're building volunteer-based mini coalitions to do the communities that care process in each of those communities. So while this particular grant, the Community Violence Prevention Grant, is often renewed by PCCD, so in the entire grant, the $300,000 grant that we have right now, we would like to reapply for that funding at the end of 2 years. We have a lot to prove, we have a lot of work to do, but we would like to reapply for that grant. Even if we were to not get the grant again, what we're doing right now, the work that we're doing right now to build these volunteer-based coalitions in each of these pilot communities could be sustained because they're actually volunteer-based organizations. So they're many coalitions focused on the work around community violence and trauma. And the idea really is that those communities will each identify at least one program, potentially 2 programs that we could bring to the community that will work on community violence prevention. And a lot of those programs are then funded by PCCD or organizations like PCCD. So the idea is that you're positioning this pilot community. I'm just going to take Anvil, for example. You're positioning Anvil to build a coalition to do all of the work to identify gaps, identify assets, look for priority areas, and then look for programs that come with funding. So in terms of sustainability, it's sort of a self-fulfilling prophecy because you are putting yourself in a position to write a grant or the new program that you want to come in. The PCCD grant that we have right now would not pay for the solutions that we're going to identify as it's a long game. In other words, we're playing the long game here on community violence prevention. Like Fitzroy mentioned, we have some short things, some very quick things that we're low-hanging fruit and we're ticking off. But this idea of these community-based coalitions is the long game, and they would then sustain themselves, hopefully. Did that answer your question?
Yes, thank you.
So I saw that Commissioner Litz also asked a question about the involvement of MHID EI. And yes, we've had several conversations with them already. And as Nikki was pointing out, the idea is that we are working locally. So the 4 communities, I don't believe I mentioned, 4 communities in Lebanon County that we're going to be using as pilot communities to implement the communities that care model. That's Palmyra, Anvil, the city of Lebanon, and also Myerstown. These communities were chosen because I don't know if you're familiar, I believe you all would be familiar with the ALICE study that the United Way has done. The United Way has a study called ALICE, which represents asset limited, income constrained, but employed individuals. So these are communities that have higher levels of low socioeconomic status for citizens. So in each one of the first 3 communities that I'm going to mention here, this is Palmyra, Anvil, and Myerstown. The ALICE numbers indicate that it's 1 in 2 individuals who are subject to economic distress In the city of Lebanon, it's 3 out of 5. So while there is not a direct causal relationship between poverty and violence, there is a very strong correlation. So because these 4 communities have such high numbers, these are the 4 that we have chosen as a pilot communities to implement the communities that care model. And so while there are county-wide agencies that are serving them, like MHIDEI, like CYS, like juvenile probation, we also appreciate the fact that the closer we are to the issue, it's the better it will be able to be resolved. And so while the county agencies do have a primary role, they're partners in the program, locally, if there is a base of concerned citizens, again, who have vested interest because they reside there, their children go to school there, their friends and family are there, they have a vested interest in the long-term well-being of their community. So forming grassroots coalitions, combining their effort, their concern with that which is provided by the county-wide agencies increases the opportunity for success in mitigating the impact of any detrimental influences that lead to problems, especially violence.
Any questions for panelists? Nikki, anything that you want to wrap around that?
You're muted, Nikki.
Of course I am. No, I just, I appreciate Fitzroy's passion for this project, and, just want to note that we are looking for community volunteers in each one of these pilot areas. We have engaged with each school district in the pilot communities. We're working with law enforcement. We're working with local government at the municipality level in addition. But we do have the opportunity to engage with just like local influencers or lay people. So if you should know anybody you'd like to suggest for the program, pass them to Fitzroy or myself. And once these coalitions get off the ground, we really think that there could be some really great insight that comes out of that at the municipality level, which is one thing we haven't really been able to do, much. We're not a big county, so, we don't often get to do things at the municipality level. And we are really excited about that piece of this.
Yeah, I was at a business development meeting. I believe Commissioner Ames was in that meeting with me, and I know he was. At that meeting, one of the comments that I made it's a comment that I often make, is that one of the reasons why I'm very passionate about this is because it focuses on engaging everyone. Because too often community members look to the powers that they identify, either individuals who have an elected position, or they have a title behind their names, they have letters behind their names. And it's an unfair burden for the larger population to simply essentially wait for the individuals, the few who are in positions of that type of formal leadership, to solve all of the problems. So we are looking at partnership. You all have your roles as county commissioners. You have, like I said, voices. You have the ability to set policy, and all of those things are critical to the long-term well-being of Lebanon County. However, we need all of us as citizens of Lebanon County to engage in the work. And we want to encourage individuals to appreciate the fact that they must join in and not simply wait for someone else to get things done. But each of us must join in and consider ourselves an asset to be able to do whatever we can, wherever we are, combining with the efforts of our neighbors to make our communities better, because it is up to us to do it. And whatever we can do at whatever strata we are in leadership, whether formal or informal, it behooves us to combine and collaborate our efforts and energies to be able to make that better future that we all want for ourselves and for our families and for our neighbors. And so we are sending out the rallying cry to everyone to use your voice and your power to encourage others to join in the work of making Lebanon County a better place for everyone.
Is there contact information that you'd like to share, the best place for people that are interested in volunteering, or that we could just make sure we have a look at that?
Yes, sir. We can certainly give you that information. So I know Nikki generally she's much quicker than I am on the typing. So Nikki, I'm going to leave that to you. But first of all, the Community Health Council's website is a great resource to access. Specifically, my email and Nikki's email are available. And so I can put my email in, I suppose. Or Nikki has beat me to the draw, I suppose. Nikki,
is there a phone number?
So I'm based at SARCC. I'm doing my work out of the Sexual Assault Resource and Counseling Center. So SARCC's number is the number that can be that I can be reached by.
I did not get your email in there yet, Fitzroy. So
Okay, I'll put that in then. Thank you.
Maybe you could email that to us afterwards, because when this goes down, the chat disappears.
Sure. Dawn, can I send that to you? Great.
And so I believe, if I may say one other thing, I'm sorry, Nikki did warn you. So not to consume more of your time. I did want to address the issue about my length of time in Lebanon, and I've met several of you before when I worked at youth advocate programs. And if you're familiar with youth advocate programs, you know that a lot of work that they do are with individuals who have been referred to them by juvenile probation and by children and youth services. So I've been on that front line to see the effect of non-prevention work. And while that work is a good and valuable work, we've all heard prevention is better than cure. And so I left youth advocate programs to adopt the approach of let's prevent rather than coming in afterwards and trying to resolve what has occurred in the form of damage. And so indeed, we would like to work very concertedly to address the risks that exist in our communities to prevent problems.
Good point. All right, anything else?
Thank you very much for this opportunity again, and you all have a great day.
Thank you.
Wish you well.
Thank you. Thank you.
Lebanon County. Thank you.
Thank you.
Thanks, Nikki.
Okay, before we wrap up here, actually, we'd like to go into an executive session personnel next to follow up on some things we discussed yesterday with you. So I think Dawn's going to get those links out to Shell, but in the meantime, so if you can hang out for a little bit, we'll make the meeting non-public and we'll go to that as an executive session. But before that, I just want to let you know, since Laura's still on here and I just got done communicating with Hal Conti at the Daily News, you may have heard by now that the Department of Health has announced the dates for the next phases of the vaccine coming out, and made some revisions to 1A, which is currently being being delivered. So let me just bring my screen up for you here a moment. If you look, this is our DES website, and it's already been updated. They did this literally within the half hour of the governor's announcement. So right here, it states the changes, and you'll find the new information below. So under the currently eligible phase 1A, these were additions. You see my cursor over here. These 4 categories were additions to 1A. So they're immediately eligible now under 1A: firefighters, law enforcement, grocery store workers, and food and ag workers. And then obviously this other phase 1A non-essential is already in play. Phase 1B starts on Monday, and that has its own category. And these links are obvious. These links are still here. So if you want to schedule with CNS, or since WellSpan is coming to the facility tomorrow, there's a link to schedule with WellSpan. I don't know whether there's availability there. They've kind of been doing their own scheduling. They've not been hand in hand up until just today. We were able to put their link up there. Then on the Monday the 12th, phase 1C goes into effect. That's right here. And then on April 19th, it includes everyone else. So anyone over the age of 16 may seek a vaccination starting April 19th. We have the links for the information only. So if anybody is in those following categories and wants to know when slots will be available or when they open up, best thing to do is sign up for that information sign up. We've been pushing that since, for weeks now. So I just wanted to let you know that. I'm sure by now you've heard about the revisions to the schedule, but we also have everything about those here on our website now. So,
Mr. Litz had a question.
Jamie, I think what they did at DES is very good, but I also know I don't know if I should call it a law, but the whatever is governing this also says that we must provide a call-in number. Could that be posted as well for each one of the?
That's down here. There's call-in for both providers.
Okay.
Yep. Yeah, and that one for CNS has been up there. The one for WellSpan was just added today. So.
Did they change their number?
CNS?
WellSpan to call in.
Oh, I have no idea. I don't know.
That's not the number I was given. And I had some people posting that the number they were calling was discontinued. So I didn't know if this was a new one or if that's the wrong one that they're calling.
I don't have any knowledge of that. Yeah.
I'm sorry?
I don't have any knowledge of what their number was, or this is,
I guess I can call them both and figure it out.
Well, no, Laura has a note up there that number that's posted is the old number, apparently.
The 638?
Yep.
All right, I'll follow up as soon as we're done here with Bob and make sure. I presume we got that from WellSpan. He's over there on site.
Yeah, you did.
So it is the 8513641. That's the number I've been posting.
I can't see that. I will double check with Bob Dowd when we're finished here.
All right. Well, somewhere they're getting the wrong number. So if that's it, I just thought I'd mention it.
They were making these changes from over there. I know Ben is over there. Bob is over there. They're all kind of doing it right on site. So, and WellSpan has some people there. So we'll double check on what that number should be.
Okay.
And the FAQ is the same, so on. So I just wanted to make you aware, and since Laura is still here with us, that she is aware. So right up here, LCDES, we really want people to go. All right. Let me stop sharing. We'll go back to this. And okay, I'll check that number, Laura. Thank you.
Thank you, Jamie.
And then, Laura, if you have anything else before we go to executive session? A second. Thanks. All right. Then, all right, now we're in executive session here.